Hey, this is Austin Fair with Fenix Physical Therapy. I'm going to show you how to do some self-traction at home. We find the best way to do it is to get two big thick pull-up bands and tie them together, and you'll want to rig it up to something. Sometimes you can do underneath a treadmill, or you can have a table that's really heavy, or if you got an at-home gym. But grab a couple bands, tie them together, and we find that traction really works well for loosening up the low back. We try to stretch it, bending forward or going sideways. We're always bending over a joint, but this is one way where we can take the spine and stretch it longitudinally, and it really gives the spine a nice feeling, good sensation. So what you'll do, you'll get inside of it. You'll put it around the crest of your pelvis. Depending on where you're stiff or sore, you may need to move it up or down, and you can play with it. But for now, we'll put it right at the crest of the pelvis or just below it. We'll walk back a few steps and get down on the ground. There we go. All right. So first thing you're going to do is lift your hips up. What that's going to do is allow all the soft tissue in your hips to kind of roll under. And the big thing you need to do first is just relax. Breathe in and exhale, and just let the band pull you straight down. It might take 2 or 3 minutes if you're really, really tight to feel the stretch, but as you breathe and try to relax, you can feel over time that stretch taking place. One of the things that I like to do is you can do a little rock side to side, not too far, maybe from 11 to 1, and you'll start to get a little stretch on either side. And then something else you can do to help loosen up the back muscles is a pelvic tilt with it. As you lay here, you can see the space underneath the back, but you can flatten it out by rolling your pelvis up, holding for a few counts, and then relaxing. And as you breathe through it, you can feel an additional stretch. Total time, 5 to 7 minutes. I'd say the big thing that you want to be careful of is when you're finished, not just to hop up. Once you are decompressed, you need a little bit of time for things to go back to the normal resting leg. So after about 5 to 7 minutes of self-traction, just walk yourself forward, wait 10 or 15 seconds, and then you can hop up. So that's self-traction with pull-up bands.